I've spent my career working focused in prevention of gender-based violence. Our next speaker, Dr. Allyn Walker, and their book, A Long Dark Shadow, Minor-Attracted People and Their Pursuit of Dignity, helped me think about my concepts of what sexual violence prevention is, and how I had to go beyond what my assumptions were and had to be able to think further about this. And I really had to think about what we want to do, and that's to prevent the perpetration of the violence. We cannot put the burden on ending sexual violence on those to prevent themselves from being harmed. We have to prevent that perpetration. Elizabeth Letourneau and Luke Malone wrote in the Washington Post about Dr. Walker. Walker's research falls squarely in the field of child sexual abuse prevention, a field that recognizes the importance of identifying at-risk populations and figuring out how to assist them in leading healthy, non-offending lives. Last year, I had the opportunity to hear Allyn Walker speak in person as a keynote speaker at the Association for the Treatment and Prevention of Sexual Abuse annual meeting. Sandra and I were sitting there, and within, I think, 30 seconds, we said, we have to have Allyn come speak at NSAC. We knew that the insights that Allyn has, and for us to be able to think about what prevention truly is. Yesterday, Nicole Pittman challenged us to think about what true prevention would be. Allyn's going to, and that pony just challenged us to think about what true prevention is, how it can't just be one topic. You're going to hear later on from Tony Porter, who's going to challenge us of what this prevention effort is, and we have to be able to think about it. Allyn Walker is a postdoctoral fellow with the Moore Center for the Prevention of Child Sexual Abuse at Johns Hopkins Bloomberg School of Public Health. Go public health, people. But Dr. Walker is not just that, is also interested in violence prevention, transformative justice, and building an intersectional and trans-inclusive criminology. Please join me in welcoming Dr. Allyn Walker.
When I first started my career, I never thought I'd be working in research. My bachelor's and master's degrees are both in social work, and my first long-term job in the field was as a counselor for victims of sexual assault. My clients included teens, children, and adults. Some of them had very recently experienced abuse and were feeling scared and powerless. Others had been abused long ago, and we're still working through feelings of shame, anger, betrayal, or even guilt. I used to leave my job every evening absolutely enraged for my clients who had been sexually abused, especially when they were children. Like my clients often did, I felt powerless myself. I never felt like there was enough I could do for them as a counselor. And what I really wished I could do was go back in time and keep them from ever having experienced abuse. What I really wanted was to prevent child abuse from occurring in the first place. We're in a country that takes sexual abuse very seriously. The United States spends significant resources on interventions after an act of abuse has already occurred. For instance, the US spends an estimated $5.4 billion annually on the incarceration of adults who commit sexual offenses against children, a figure that does not account for dollars spent on police, court costs, supervision post-release, or registration. In comparison, however, the US government spends very little on preventing child sexual abuse. Congress allocated $2 million for child sexual abuse prevention research for fiscal year 2022, which was $500,000 more than they allocated the prior year. So again, that's over $5.4 billion toward punishment versus $2 million for prevention. We don't concentrate on prevention nearly enough. When we do talk about child sexual abuse prevention in the United States, what we're commonly referring to is programming to teach children about appropriate kinds of touch, to say no to touch that makes them feel uncomfortable, and to report abuse they have already experienced to trusted adults. To be clear, it's very important to teach children that they have say over their own bodies and that they're allowed to say no to things that make them uncomfortable. However, exclusively utilizing a prevention strategy of teaching kids to say no to their abusers inappropriately places the burden of preventing child abuse onto children themselves. Moreover, because this type of programming is largely aimed at teaching children to report abuse that's already occurred, research shows that these programs are more effective as an intervention strategy with little evidence to show that they prevent offending. So again, we're back to talking about interventions after abuse has occurred instead of true prevention. Strategies that seek to teach people how not to become victims are no doubt well-intentioned. This kind of victimization prevention, however, can lead to victim blaming. When we teach children that there are things they should do to protect themselves from sexual abuse, what are we saying to children who have experienced sexual abuse? That they did something wrong? That it was their own behavior or lack thereof that caused their abuse? That they are, at least in part, to blame? Let's sit with that. Let's sit with how wrong it is to give that message to children. Instead of interventions after the fact and teaching children to prevent their own victimization, the work of my research is child sexual abuse perpetration prevention. Perpetration prevention means that we're not just trying to keep people from becoming a victim, because no one just becomes a victim. They get victimized. But when we engage in victimization prevention, another hidden message we're telling children is, here's what you can do so someone else becomes a victim, but not you. Alternatively, however, we can focus on reaching people who might be at risk of carrying out an act of abuse. We can stop people from ever even attempting to harm a child. That is what perpetration prevention intends to do. Back when I was working as a victims counselor, I had not realized that people with attractions to children and people who commit sexual offenses against children were different populations. When I was first introduced to the idea that there was a difference between these two groups, I was stunned and I wanted to learn more. I particularly wanted to know what we could learn from people who have those attractions but who do not harm children. Whether they had any strategies that kept themselves from abusing children that could aid in prevention efforts. So I started trying to look that information up, but as it turns out, at the time, there was really no research on that subject. There wasn't much research at all about the population of people who are attracted to children, but who have never harmed a child and who never want to. So I decided to do that research myself. As part of this line of research, I interviewed adults who are attracted to children who have never engaged in sexual activity with a child. Within interviews, I asked my participants questions about how they came to understand and cope with their identities as people who are attracted to children, how they strategize not to commit sexual offenses, and how our society can support them with their commitment not to harm children. The individuals I spoke to in my research grew up in a society, our society, that told them people with attractions like theirs were monsters, destined to abuse children. Another phrase they used to describe how people thought about them was ticking time bombs. So when they figured out that they were attracted to children themselves, they were frequently horrified. They associated themselves with child abusers. They thought they were evil, and that they were doomed to become violent. Some described themselves as instantly suicidal, as being terrified of themselves, as being hopeless. Just as I did not know when I first started my career in social work that people who were attracted to children were not the same as sexual abusers, the people I interviewed did not know this at first for themselves. No one was telling them about people who had these attractions who did not go on to harm a child. No one was telling them that people with attractions to children can still be good people, can make positive choices, and can help to keep children safe. Quite a few of my participants wanted to seek help from someone, but they frequently felt that they had no avenues to turn to. Often my participants hid their attractions to children from friends and family, and quite a few of them hadn't told anyone about their attractions at all, despite sometimes knowing it for themselves for many years. One of my participants even told me during our phone call interview that our conversation was the first time she'd ever acknowledged her attractions out loud, even to herself, although she had known this about herself for 8 or 9 years. She called our interview the bravest thing she had ever done. When I asked people who hadn't told anyone else about their attractions why they hadn't done so, they often indicated a fear of hurting their families, fear of losing friends, loved ones, or employment, fear that people would become violent toward them, and even fear of criminal justice-related repercussions, all for merely saying that they were attracted to minors, despite having committed no crimes. Those who did disclose their attractions to friends and family sometimes received support, but others were kicked out of their homes, abandoned by family and friends, outed to others, reported to the police, forced to leave their schools. Another option people came up with was talking to mental health care providers. But despite a common interest in accessing counseling of some kind, many of my participants were turned away by treatment providers. And some were even told by therapists or counselors that they would have to contact the police or report them to other individuals, such as their professors or school administration. Again, these participants had never disclosed doing anything illegal or even planning to do something illegal. Many other participants explained to me that although they were interested in some kind of mental health treatment, they refused to seek it out because of a fear that providers would turn them away or report them, as some had done to others, or because of a belief that providers who would treat them as a human being instead of as a monster would be too difficult to find. So a lot of folks who are interested in seeking help are not doing so, even if they feel that they need help in order not to offend. The theme of this year's conference is equity in action. Yesterday, a challenge was issued to us to determine what equity in action means to us. To me, equity in action means making quality mental health care available to everyone. It means changing our culture that currently tells children they should be responsible for protecting themselves. Changing our culture that currently gives survivors the message that they did something wrong. And changing our culture that simultaneously refuses to give help to people who want and need it. People who are actively saying that they are at risk for harming someone else and have nowhere to turn. It can be terrifying to be in front of a large group like this, talking about why people who are attracted to children deserve mental health care, asking us to shift our understandings of this population from monsters to people deserving of dignity and help. But it's so exciting to be in this room with all of you fierce advocates who know exactly what is at stake and who know we need change. With change, we can prevent the perpetration of child sexual abuse. We just have to be willing to do the work. Let's do it together. Thank you.